right, great. Well, good afternoon, everyone. It's always great to come together to sign a law, and in this case, a law that's going to save lives. And I want to thank everybody, both those who've joined us in the audience, who've been strong advocates, and those who are up here with me, who worked so hard to make this day possible. To Senator Joan Lovely and Representative Ruth Balzer, early sponsors of this important bill. To Senator Mike Rush and Representative Jamie Murphy, who were the sponsors of this. We appreciate your leadership as well. Joining us here today, Minority Leader Bruce Tarr. Good afternoon. And we have Reps Sean Garbely, Reps Tom Walsh, among others who are with us today. But I know so many in the legislature and their teams have worked hard over the years, Senator Moran, to support and advocate on behalf of constituents, an issue that probably touches just about every family in this state, at some point or another. And so we're really, really pleased to be able to be here today and grateful to all of our advocates who've done so much over so many years to both raise awareness, to advance research, and improve policies around women's health. Dana-Farber Cancer Institute, one of our GEM institutions here in Massachusetts, represented today by President and CEO Dr. Benjamin Ebert and members of his team. American Cancer Society's Cancer Action Network, Mark Heimovitz is here with us. The Susan G. Komen Foundation, Liz Strawn, Angelica Katz. Boston Breast Cancer Equity Coalition, our Breast Cancer Coalition, doctors, health plans, fundraisers, thank you all. Also joining the Lieutenant Governor and myself today are Secretary of Health and Human Services, Kate Walsh, and our Commissioner of Public Health, Dr. Robbie Goldstein. Thank you to all in the Executive Office of Health and Human Services for your work on this as well. We're pleased to confirm that Mass Health already covers each of the items required in this law. Now they are covered for everyone, no matter where you get your coverage. If there's one thing we know about breast cancer, it's that early detection saves lives. And today is about eliminating barriers to that earlier detection, whether they're barriers of cost or other barriers. We want to eliminate those barriers to make sure that people have access to the kinds of screenings and the kinds of care that will give us those early detections and therefore improve outcomes. Importantly, we in Massachusetts, we're proud to have the highest rate of insurance coverage. We have more people covered by health insurance in Massachusetts than any other state in the country. That's something that we should be proud of. Massachusetts is also the state, number one for innovation, number one for education. We're the state where cures are being found and treatments are being discovered. We fund this work through the Massachusetts Life Sciences Center. Thank you to the legislature for your funding of that, which includes special grant programs for women's health research. We've made a concerted focus this administration, working with the legislature, focusing on women's health. I signed a maternal health bill not too long ago, and we found other ways to provide money to research institutions to help with more focus on women's health. And today is another example of that. The Mass Leads Act that the legislature passed last week, that I look forward to signing very shortly, will allow us to continue and to increase that funding. So as we celebrate this milestone today, I want to also say that we are not done. Our fundamental priority as an administration is going to continue to be the well people of our citizens. That's why Massachusetts was voted the best place to live if you're a woman, the best place to have a baby and raise a family. And I'm proud to say that that includes female health care as well. So this is legislation that builds on some of the work that we're doing. I also want to say it's our job to make sure we're supporting our providers out there, our doctors, our nurses, our researchers, our scientists, all who are out there providing these screenings, providing treatments, and developing cures. And it's our job to continually work to raise awareness and remind all of our family and friends to call for these appointments and to get your screenings done. And with today's bill that I'll sign into law, that will be more possible. Thank you for all your hard work and dedication, and let's continue to do all we can to make Massachusetts a safer and a healthier place. And with that, I'd like to invite to the podium terrific legislator and advocate on this particular piece of legislation, Senator Mike Rush.
Thank you very much. I want to thank the governor and the administration for their commitment to health care. As we all know, health care is a right and not a privilege. And we worked hard with all the legislators here. There are many here, all involved in getting this bill to the governor's desk because we do believe that it's a right and not a privilege. And again, Dana Farber has been an outstanding advocate, and they approached Representative Murphy and I, but the bill had been filed by Rep. Balzer and Senator Lovely, as mentioned by the governor. But it takes many hands, and we all work together to get it to this point today. So I want to thank all my colleagues in government for their commitment and hard work. I also want to thank the Senate President, Chairman Rodrick, and the Minority Leader for really getting behind this bill because it makes sense. No individual should have to choose between their own health, possibly their life, and paying bills and supporting their children and families. So this is a bill that makes ultimate common sense, and it is the greatest example of how government can work together to solve problems that need to be solved. So it's an honor and a privilege to be here with all of you today. At that point, it is my privilege to honor and introduce the chair from the House. Work together to get this done. Chairman Jamie Murphy.
Thank you, Michael. Thank you, Senator. A lot of us in this room, my colleagues over here to the right and my colleagues behind me, go back a long way, as did this bill. This bill goes back to, I think, 2017, and a lot of us picked it up where others had left off. So the credit goes to all of you in the audience here, all the advocates that shared your stories with us. Very, very compelling, heartbreaking stories to hear. The committee hear testimony about people that have gone through so much. And a lot of it came down to the barriers of access here. We have the greatest hospitals in Massachusetts. My wife is a nurse, and I run at Beth Israel. But imagine how many people cannot afford to get the proper screenings, and health insurance may not cover the proper screenings. So this bill will quite simply just save lives. That's it. It'll save thousands of lives because of all of you in this room and your advocacy. I want to thank the governor, lieutenant governor, their administration for being such advocates in support of our bill. It's an important day today for so many people. When I look at the numbers, we were looking at numbers during the hearings. 1 in 8 women are diagnosed with breast cancer each year. 7,000 women in Massachusetts would be diagnosed with breast cancer just alone in this state. 71% of the people that are diagnosed have dense breast tissue, which requires very expensive screenings that most people cannot afford. A lot of women will get tested, will need further testing, but cannot afford the further testing, and that's tragic. As the governor mentioned, we in Massachusetts have led the way in so many ways in regard to health care, and this bill is one of those pieces of legislation that's going to save people's lives, and so it's an honor for me to be here. On behalf of all my colleagues here who are sitting here, on behalf of Speaker Mariano and Chairman Mikowitz in the House leadership, it's because of all of us together working, as Mike said, that thousands of lives are going to be saved. So thank you all very, very much. I have the honor of introducing a senator from the North Shore, Salem, you might have heard of it, Senator Joan Lovely. Senator?
Thank you, Mr. Chairman, and good afternoon, everyone. What a great day to be here today to be signing this bill. I, too, want to thank everyone in this room, so many outside of this room. Representative Balzer and I sponsored a bill together back in 2017 to include 3D mammography tomosynthesis that would have every insurer cover it. And as the governor had said, you know, we are number one, but we were lagging in this. And we heard so many stories in hearings from particularly women who were inactive, either inactive breast cancer, they couldn't afford 3D mammography, so they forewent that further testing to confirm that they actually had a breast cancer diagnosis. And now we were looking at stage 3, stage 4 breast cancer, and some women who did not survive. So that's why we're here today, to make sure that every woman going forward, and men, anyone who needs this type of procedure and screening, gets that screening. Particularly for me, I have dense breast tissue, so that means that I'm a little harder to screen. And so I'm so grateful when I go get my yearly mammogram that tomosynthesis has always been available to me and will continue to be. So a bevy of thank yous to so many people why we are here today, to Senator Rush, thank you so much, and Chair Murphy for your leadership for getting us here today, to the Senate President, to the Chair of Ways and Means, to our Chair of Healthcare Finance and Financial Services, and to Dana Farber, I want to shout out Scott Hartman of Dana-Farber as well, Mary Jane O'Neill from Beverly Radiology Associates, and Sharon Hayes, who someone I graduated from high school with and happened to be the office manager for Beverly Radiology Associates, and contacted me in 2016 and said, we don't offer this and we really need to. And we want, they did offer it, pardon me, but we want every person to be able to have advantage of it. So we're just so very grateful that we are here today to be able to celebrate this bill, and again, as was said, to save lives. Thank you so much. Now, it is my honor to introduce Representative Ruth Balzer.
Thank you, everyone. This is really indeed a great day to celebrate this accomplishment. I want to thank the Massachusetts Radiological Society, who does such a great job not only of taking care of their patients, but of educating the public and educating the legislators and having educated me about this important issue, about making sure that there are no financial barriers to women or anyone getting the care that they need and deserve. And just a shout out, of course, to our wonderful governor, lieutenant governor, the whole administration, to the House and Senate leadership, to all the members, but most of all to this great state, the Commonwealth of Massachusetts, that once again is stepping up to protect women's health. Thank you all.
Hi, my name is Ben Ebert. I'm the president and CEO of Dana-Farber Cancer Institute, and Dana-Farber is deeply grateful to the governor and to the legislature for passing this Breast Cancer Equity and Early Detection Act. We particularly want to thank Senators Rush, Senator Lovely, Representative Walsh, Representative Balzer for their advocacy and for their leadership. We know that screening mammography decreases mortality from breast cancer. We also know that there are major disparities in outcome for breast cancer. For example, white women and black women are diagnosed with breast cancer at about equal rates, but the mortality from breast cancer is 40% higher in black women. Dana-Farber is devoted to righting these disparities. We have a mammography van. We support a mammography clinic in the suite in the Whittier Health Center, and have done since 2002 24,000 mammograms through our mammography van in underserved communities. However, in 12% of cases, there's an abnormality on the mammogram, and that requires further study. It may require another mammogram, an ultrasound, or an MRI, and typically that follow-up screening costs hundreds of dollars out of pocket. This bill will remove that financial barrier to follow-up tests. That will decrease disparities. It will improve the efficient diagnosis of breast cancer at an earlier stage where outcomes are better, and it will save lives. So thank you for the opportunity to speak today. Congratulations on the bill, and this bill will make a real difference and save lives throughout Massachusetts.
Thanks so much, Dr. Ebert, and welcome to your new position, too. we're gonna sign a bill. I'm gonna sign a bill in just a minute here. I also just want to acknowledge some other folks in the audience. We have the president of the State Police Association of Massachusetts, Brian Williams, with us here today. His mother's a nurse, and I appreciate you being here. I also appreciate John Nalvin being here, executive director of mass.gov. And there are a lot of organizations out there that do a lot of races, do a lot of events in support of efforts to combat cancer and to treat cancer. And there are many of you out here, and I just want to thank all those organizations that also find ways to show up for people in this state. And to all of you out there who are dealing with breast cancer right now, dealing with cancer right now, know that I firmly believe that you are in the best state in the country. You and your families are in the best state in the country, and that's important. I've had cancer in my family. I lost my dad to it years ago. As they say, this particular issue, breast cancer, we know inevitably seems to touch all of us. And so it's just to say, I want people to know I'm proud of the work that this legislature has done, this administration has done to continue to be a leader in making sure that people are actually able to access care. It didn't make any sense for people to be able to get initial screenings and then not be able to afford or access the screening that you actually need when maybe a problem is detected or you don't know if an issue is there because you have denser breast tissue. So really excited to see this done today, and know that we as an administration and a team are going to continue to work with our incredible system of research institutions, teaching hospitals, healthcare providers, amazing life sciences companies. We have something special in Massachusetts, and the residents, the citizens of Massachusetts are better off for it. So today we celebrate and send strength and love to all those who are living with breast cancer and cancer in Massachusetts. And let's bring the table forward, and we'll make this a law. All right.
Please sit down.
We all in? We did it. It's great. Excellent. You think I'd know this, but it's the 16th, right? 18. That's why I asked. Great.
139.
Be nice if time stopped.
Thank you for this. This is amazing.
It's great.
Quite beautiful.
Oh. Hopefully help a lot of people. All right, and we have a bill. Thank you very much.
Thank you, Governor. Thank you very much.
Thank you, Governor.